Okay, so part 2, diagnostic quality. So this is chapters 9 and 20 that you have to read for this part. And this part might seem a little bit kind of silly because we aren't developing anything with a traditional film. We're not using traditional films. We're not using traditional or older developers. Everything's digital. But it is still important to know this information. It still can be tested on the boards, and you still may work for an office that does this. It's probably not as likely, but it could happen, and it's important until it's completely not used 100% that you still learn about it and are familiar with it and have some understanding of traditional film use. So with that being said, let me advance the film. And so the objectives to define and, oh, wait a minute. Did I just jump all the way? Oh, my word. It jumped to the beginning. Sorry. Skipping. Here we go. Analysis of errors and artifacts. That's where I meant to be. Okay, so objectives to recognize recognize errors and the techniques of the errors. There's a little typo in that sentence. Recognize and correct processing errors. So understand what can happen if you're using a processor incorrectly. Analyze an FMX for errors and necessary retakes. Now that is actually not in this. That is not in here. So I am going to make a separate short video on just this objective because as I went through this PowerPoint, I noticed that that's not there. Observe things like penumbra, magnification, distortion through shadow casting activity, and also that is not in this PowerPoint. So these are separate exercises and things that I'm going to make separate videos or separate homework assignments for. So types of errors. So there's technique errors when actually taking films, and then there's processing errors. And technique errors, as we've talked a lot about, are placement errors, horizontal angulation errors, vertical angulation errors, and beam centering errors. Technique errors are things like movement. The tube head might jiggle on the arm. The patient might move. The sensor maybe moves in the mouth. The patient kind of changes their bite mid-exposure or something. There's movement somewhere. Another technique error would be if you're using traditional film. Let me get my cursor over here. If the film is backwards. So as we know with our digital, if the cord is coming out of the back of the sensor, so the smooth part of the sensor is the face or the front, but with traditional film, like you see over here in this picture, where the envelope sort of opens up, you can actually open up the whole film packet. That's the back, and the smooth surface with the convex dot is the front. So that's sort of how you would identify. And we can look at these too in lab. I'll have a few. When you first come in next week, we'll have a couple things out here for you just to kind of look at, and so you can be familiar if you haven't seen it before. Okay, other errors, the dot artifact. So if we go back here and we look at this little dot, this is a convex dot that you can actually feel it. It's raised on the film. And if that dot is in the apical region of a tooth, then that someone might think that is some kind of pathology. They might think that that's an abscess. So there's something that they say the dot in the slot, and that's because the slot, where this is talking more about traditional film, is the area where you would be closest to the occlusal surface or the biting surface. So if the dot is down by the incisal edge or down by the occlusal edge, the occlusal surface, then you know that you can recognize that that's the dot, the indicator dot on the film. But if you have it turned upside down and the dot, which just ends up looking kind of dark, is up by an apex of a root, you might think that that is an infection. So the dot always goes in the slot. We don't have to worry about that with digital, but that is something to be aware of with traditional films. Dimensional distortion. This looks to me kind of like, I can tell over here that this film is bent, and there's extra light there if it if it never got developed or something, it only got fixed, or I don't think that's a cone cut, because you don't usually see a cone cut so perfectly lined up with this crease, which looks to me like the film got bent. And then it looks to me like halfway through the exposure process, the patient moved their head significantly. It's like it started out okay for a second and then it moved, or something moved. So that's what that looks like to me. It wasn't really explained well in the book. I didn't see this term dimensional distortion. If you guys see it in the book, please let me know, because I looked and I couldn't find it. Oops. Bending marks. So again, with traditional film, we used to bend the film in the corners to help compensate for the discomfort of the sharp corners if patients couldn't tolerate it. So they bent the edge and it distorts the film. And so obviously that part of the film is kind of messed up. These are fingernail artifacts. So they were pinching it, I guess, or when they were taking it apart, maybe they had long fingernails. Double image, so they used the same film twice. They took a molar shot, then they took a lower anterior shot. What errors do you see here? So what can you guys imagine this might be? This is a digital image, and this is the cord. So when we're in our operatories and we take a film and it's blank, there's no image, then what could have happened? Well, this doesn't often happen with digital, but it might be that we left the BID over at the wall. Maybe we set everything up and said, okay, you're good, and then we went and pushed the button, but we forgot to bring the BID over. So this happens especially when we're nervous and we're thinking of all kinds of things, and we're just, trying to make sure that our placement is right and that the patient is tolerating it, and then we totally forget that we need the tube head. Forgetting to turn the machine on, so you might have brought your BID over, but maybe you didn't turn the machine on. Or I've seen a couple times the sensor is backwards, and so the back of the sensor with the cord coming out is facing out instead of the front of the sensor facing out. That has happened too. And then also sometimes we get a little hiccup in our technology and we have to reboot, and so sometimes that happens with digital too. What error do you see here? What do you think these rootless floating ghost teeth are? What could that be? If you said a denture, you were correct. That's someone left the denture in when they took the film. So developer errors. So these are, this AT2000 is one that I used for years and years. If you're a dental assistant that worked for a long time before digital, you might have used it, or they may still have one in the office that you worked at. This is very common, the AT2000. Oftentimes it's in a dark room, but if you had no dark room, then they had this little apparatus where you could put your hands into this dark box, and so you could do it out on the counter. And then the whole thing is dipping the film goes through this whole roller process of, it goes into a tank with the fixer, and then it washes into the water, and then it goes back into the developer, and then it washes, oopsies, and then it washes, and then it dries, and then it comes out up here. So you put it in down here, and then they pop up out here. Processing errors. So higher density films. So if something has a higher density or is overall a darker film, some of the possible causes could be excess developing time. So they were the speed of going through the developer was too slow, and so they got overdeveloped. High developer temperature, if your developer is warmer than it needs to be. If there's an inaccurate thermometer and just the temperature readings are off. Overactive developer, if you have really fresh solution, and it's just like really active, it can darken your film as well. Low density film, an overall kind of ghostly, whitewashed, light appearance. Inadequate developing time, so not enough time in the developer. Low developer temperature, your developer is too cold. Inaccurate thermometer, so it just doesn't have a good temperature gauge. Or depleted developer solution, it's old and worn out and you need brand new developer. So changing the chemicals was a process that happened all the time when you used traditional films. And they usually had a schedule, like, once a month or whatever it was. Processing errors. So here we have things that you may see, these splotchy dark spots here and here and here, and it's kind of over here too. This is developer chemical spots. Saliva contamination. It got wet and maybe messed up the chemical coating over the film. A fixer cutoff. So here in this picture, let's see, what would that mean? That means that the film never actually got any fixer and was only, I'm trying to remember now. Let me find one and then see what it says here. Fixer cutoff. I think I wrote it down. Sometimes it's because the film itself got exposed to light, but fixer, oh here it is, fixer cutoff, a straight black border. And it's, so if it got exposed to light, it's more fuzzy. You kind of have like the little bit of gradual. This is really sharp. So unfixed portion of the film due to low level of fixer. So this portion over here that's black never got fixed at all. It just got developer, so it went totally black. Check fixer level before processing, add solution if needed. So that would tell you that something going on with the level of the fixer in the processor. And then on the next one, black artifacts, you can clearly see that looks like fingerprints. You can see that these are two films that got overlapped. They probably put them through the machine too quickly. And then here's a light leak, and you can see how it's more, the black from the fixer was very, very, very defined, but this is kind of like fuzzy sort of. So it kind of, this part got more light, maybe this part got less light, and then it was finally out of the light. White artifacts, so this is fixer droplets. So the dark droplets on the film was developer, the white is fixer. Air bubbles, you can see all these little air bubbles in the chemicals. And then developer cutoff. So this one got 100% fixed and didn't get developed at all. So it's the opposite. The level of the developer is too low. Stains on a film, exhausted developer or fixer chemicals are just old and they're not working well anymore. Insufficient fix time, insufficient rinsing. If it leaves chemicals, then it doesn't wash the chemicals off, then it can kind of cause stainage. Static electricity, you can kind of tell that's what that looks like, right? It looks like a little lightning bolts. Moisture contamination again, something, the film got wet before it went through the developer fixer process. And then kind of an overall fogginess look, fogginess of the film, outdated film, maybe it's really old, improper film storage, maybe it was stored somewhere where the temperature maybe affected it, or there was a lot of light or something. Radiation before or after exposure, so keeping exposed film in a room with the in the patient. So if the film is out where the X-ray photons are flying around, then it might actually affect the film. So they need to be put away behind something that the radiation doesn't get to them until it's ready to use the films. Higher developing solution temperature, so if stuff is too warm, it can cause this effect. Torn emulsion. So this is the kind of coating on the film before the fixer and developer gets in there and takes it off and does its process. So this got like scratched before it went through the process. Doubling up on the film, that's what's going on here. The films went in too quickly. They put this one in and then they stuck this one in and they stuck to each other. And then this to me looks probably a bit like, I'm trying to decide if I think it's fixer or light exposure. It looks like a little fuzzy, so I almost want to say it's light exposure. You guys will have to determine, what do you think that is? Do you think it's a fixer? Got cut off from the fixer, or do you think it's light exposure? I'm kind of on the fence. Okay, automatic film processing errors, tips for feeding in the film. So when you're standing there in the dark room or in front of a AT2000 or whatever machine, all of a sudden I don't know what they're called anymore, developing machine, developing x-ray thing. Oh my word, you guys. You need to, basically you just want to make sure that you're feeding them in a nice and straight and that you're going slowly. You can kind of feel them gradually going in. And usually there's a light indicator that gives you kind of a go ahead, like here's the light, you can feed the next one. And you do it, I always did it from right to left. So first I do a left and then I do a right and then I go back to the left and then I go back to the right. And so I'm not doing like the same spot over and over, because if you do that, then oftentimes that's where the doubling up happens. Don't feed damp films into the processor. They should be dry. Films should not be fed too quickly in succession, which we said. Okay. Alrighty, that is that bit of the PowerPoint, and then I will get a couple other videos together for the other content. See you soon.